Today's episode is sponsored by Travere Therapeutics.
Welcome, everyone, to the Kidney Korner Podcast. I am your host, Craig Merritt, the founder and executive director of the Get in Position Foundation, where our motto is make sure you get in position as it relates to your health. Listen, folks, I am excited again. I'm always excited to have special guests on the Kidney Korner Podcast, especially those in the healthcare industry. As you all know, the Kidney Korner Podcast is from a patient perspective. So it's always great to have healthcare professionals. And one of our disclaimers is that I'm not a healthcare professional, but I'm an experienced professional. But we're going to get the 411. We're going to get the scoop. We're going to get the information, the real deal of what's going on. Our special guest today, I'm excited to have her on. I didn't know too much about her. I met her at a American Kidney Fund event, a symposium in Washington, D.C. She was on a panel, just great things, great speaker. And without further ado, I'm not going to belabor the moment. Ladies and gentlemen, please welcome Nakia Davis. Hey, Nakia, how you doing?
You're great, Craig. How are you?
I am awesome sauce. Had a few technical difficulties, but we worked it out.
We can work it out. No problem at all.
Anything can happen on the Kidney Korner, but we're gonna have some fun today. We're gonna talk about caregiving, and I'll be honest with you. We've had other guests to talk about caregiving, and they were actually the caregivers themselves, even though we know you are a caregiver. But I tend to believe that you're a caregiver from a healthcare professional side, profession side, right? You're a caregiver from that side. You're actually a nephrology nurse practitioner.
Correct.
All right. So I follow you on social media, right? And your name pops up, but there's a bunch of other letters behind your name. It's almost like it's spelling a whole nother name, but it's separated up. So Nakia, please explain to us what all the damn numbers and names. What is it? What do you do? No. Here's the question: what is it that you don't do? How about that?
Well, those are just my credentials, my degrees, my certifications, and my fellowships. So that's all.
That's a lot of schooling right there. That's a lot. Are you enrolled in the tuition forgiveness program?
I need to be for sure.
That's a lot of schooling.
I like to learn. I like to stay educated. Obviously degrees are different from certifications. Certifications are, by choice.
Right.
So, you choose to be educated a little bit more, and then fellowships are, earned basically,
Right.
So both of my fellowships are in nephrology, one with the National Kidney Foundation and the other one with the American Nephrology Nurses Association. So it's to highlight the things that you've done, in the community related to kidney care for those particular two fellowships. So
awesome. Listen, you definitely know what you talking about. Whatever we talking about, you know what you talking about. I'm just taking a stab at it. That's all I'm doing. That's all I'm doing.
I
So
try to stay informed. Try to stay informed.
and you are well informed. I tell you, you are the 411 of nephrology. I tell you. so what? Let's go this route first and foremost. To our audience and viewers out there, being that you have all these certifications, that the credentials speak for themselves. What really made you want to go in that particular specialty and area of nephrology?
Well, believe it or not, so my first degree I have is in biology. So when I chose biology, I wanted to be in the medical field. And then I was like, I did not want to go to med school and do all those years of school and everything. But, I love science. I love medicine and all of those good things. So then I went to Tuskegee University. I'm repping Tuskegee today.
I see you repping.
And so when I came back home from Alabama, looking for a job, old school, through the newspaper, and saw a job in dialysis. And I was like, oh, that looks sciencey. I had no idea what dialysis was or anything. And so I'm, reading about it. I'm like, oh, okay, go for the interview. This is for a dialysis technician position, actually.
Okay.
Went in for the interview. I tell people this all the time. It's just too funny. Went in for the interview, talking to the lady, everything sounds good. And then she's like, oh, you want to see the clinic? I'm like, oh, yeah. So we're walking around the clinic and my eyes are like, what in the world? And I was I don't know who they think that I am, because I'm like, is that blood? And she was like, oh, yeah, that's blood. And I'm like, oh, man, did I misrepresent myself? Like maybe I'm saying something more than what I was like, I don't know how to do any of this. She was like, oh, we train you. I was like, oh, okay. Cool. And so that was like back in 1999 when I fresh out of college and started off as a dialysis technician. And I've been in kidney care since 99, various roles. Obviously, becoming a nurse and then a nurse practitioner. And I always tell, people, and I think you heard me say it in DC, that I didn't choose kidney care. Kidney care, chose me, So even going through nursing school, you do your different rotations and different units, trying to see if it's other things that you like. I didn't want to limit myself. And this is my comfort zone. Obviously I've been doing it, 27 years. Mm-hmm. But it was really, truly nothing that I wanted to do. And I was like, this is where I'm supposed to be.
Well, that's truly a calling, right? When you're not looking for it and you just end up in it, and I can tell you the knack you have for it, and it just comes with ease for you. That's when you've been called. So that's awesome. And being a post-transplant patient myself and being on dialysis, you all are so important and vital to that process for dialysis patients, and especially in our community. So shout out to you, big up to you, and thank you so much for answering the call. So there's some other things that I read. Mm-hmm. Just a little short bio that you specialize in the management of patients with end-stage kidney disease, in outpatient dialysis in the center, and also home dialysis. I read that as well. One thing that really stood out to me, Nakia, was develop individualized treatment plans. Let's actually talk about treatment plans, because I know we're going to get into the caregiving thing, but this has a lot to do with it. as far as treatment plans are concerned, most dialysis patients don't even know about a treatment plan. First of all, define a treatment plan for us.
Treatment plan will be, and I totally believe in patient-centered care and the collaboration with the patient, as far as the planning of their treatment. Not, obviously there's certain things we have to, follow for the health of the person. And right. I believe that needs to be thoroughly explained to the person. I don't believe in just, writing a treatment plan without the patient's involvement or at least knowledge. I mean, and especially with our home dialysis patients, which is a little more flexibility, and what you can do with those patients, considering their lifestyle and what their goals are. That's why I loved home dialysis, so much. But, anyway, you can have more flexibility with that treatment plan with that patient. So just for instance, if somebody is not having adequate dialysis when you're drawing their labs and you have to increase their dialysis. So, it's a conversation with the patient. These are the things that we could do. Pick the one that you would like. I mean, I know you don't want to do any of them, but pick the one right, that you would like that will work better, for your lifestyle,
Okay.
So, and even with in-center dialysis, sometimes, you may have a person who needs to remove, a lot of fluid and they may need to come in for an extra treatment, but a compromise for that particular person. Hey, do you think for a couple of weeks you want to stay a little while longer so we can get this fluid off of you, as opposed to you coming in for a completely new extra day with new needle sticks and all of that? Which one would you like to do? So those are kind of compromising things that I do with the patients.
Now I'm tripping because I'm like, where was you when I was in the because I love that. And one of my pet peeves or practices as a patient, and I'll call it that. It was one of my practices was that we needed to partner. Me and my healthcare team, it's a partnership. Mm-hmm. Why is it that I don't know my treatment plan? Why is it that we're not talking about it together? Right? Because I'm the one being treated, right? So
absolutely.
I think I need to have an involvement and a say here. Absolutely. Yes, I may not have all the credentials and certifications that someone like you may have, but I know me, right? I know me. I know my body.
Exactly.
Again, where was you?
And even when I'm reviewing labs with patients, instead of saying, "Oh, all your labs are good," or this lab is bad, I go line by line, one by one, whether it's good or bad. And we talk about it. So if you have, great protein, you're doing a great job keeping your protein, in line. This is the goal that we want. You're following the goal. And the way you continue that is to continue eating your meat, chicken, fish, whatever,
right.
I talk to. So whether it's bad or good, I'm not just always telling you the bad stuff. But when I do tell you the bad things, we go over what are the barriers. It's not, you're a bad person, you're not doing that. I mean, you never know what type of life people are living, what's going on with them. We know the different, labs that really get people with kidney disease down, the phosphorus, for instance,
Yes.
And how hard that is to maintain the pill burden associated with that. Like, I am completely like, okay, are you taking your binders? And I know in my mind,
they ain't taking them binder. They ain't fooling with them binder.
I know in my mind they may or may not, So,
but you gotta ask the question.
I gotta ask the questions.
They could say, "Yeah, I'm taking it," and then that particular binder may not be working.
That might not be working for them,
right?
Also, some of the binders are huge, so they already know they can be honest with me. Are you taking them? No, so why aren't you taking them? Those pills are so big. Okay. We have other ones, are you open to trying a chewable? Are you open to doing this? We have to we have to partner to see what's best for the patient so they can be compliant.
Listen. I heard you say earlier you like the science, right? So I'm gonna ask a weird off the wall question. Are you into cloning? Because we need to clone you. We need to clone you and put you in every dialysis center. You down? Could we get samples or something? Because I'm joking and we're having fun here on the podcast, but that is a serious thing, having someone who actually will take those labs and sit down with an individual and go line by line and explaining to them that is everything.
Yeah.
Kudos to you. Shout out to you once again. Man, Lord, I
want the people I take care of to be built up, for success. And when they're with me or not with me, people travel. I encourage travel if they're healthy enough to travel. But I want you to be able to go wherever you're going, whatever state you're in, whatever country you're in, to know how to take care of you.
How to take care of yourself, especially dealing with end-stage renal failure. Exactly. And when you talk about dialysis, we're specifically speaking of hemodialysis. Is that correct? In center and home?
I take care of home dialysis patients too as a nurse practitioner as well. So yes.
So that's hemo at home, right?
Hemo at home and peritoneal dialysis.
Oh, PD. Okay, okay. And PD. That's included.
Yep. So
yeah.
Okay. Hemo, home, hemo, and peritoneal. I take care of all three.
Okay. All right. Awesome. So the next thing I wanted to ask is because, again, we've had other caregivers on the podcast, and they were actually like family members. They were not healthcare professionals. So from a healthcare professional or healthcare provider perspective, how is your approach to caregiving differ from a family member's approach to caregiving? Or is there a difference?
I think for me personally, it may not be too much of a difference because my sister was on dialysis too.
Okay.
And I was already in kidney care before she even started dialysis. So it wasn't like, oh, she's starting dialysis, let me learn about it or anything like that. I was well into my career before she was diagnosed.
Oh, okay. Yeah. I got you.
So, but it did change my perspective when she started dialysis, and I started to see the patient side of dialysis, because we're going in, we're, taking care of you, do this, that, and the other, whatever, but you don't see the other side of the person when they're not in the chair. You don't see them.
Yes.
You don't see them being, a sister, in her case, an aunt to my, niece, or a mother or father or whatever. And some patients, I don't even really like to use the term, these are people on dialysis. Some of those people that are on dialysis may be a caregiver to other people. These people are still working. They're going to school. They're doing other things besides being a patient to you in the chair. And especially from a home dialysis, perspective, because we would love for all our patients to be home, home dialysis, because we know there's, some better outcomes with that, if that's available, for the person. But some of my people who decided that they didn't want to do it anymore, hearing that side of it, is their home is a medical facility, and they rather come to treatment outpatient, do their 3 days a week for however many hours, and then come home and not even look at boxes and supplies and all of these things, so you don't think about those things if your patient never tells you that,
Okay.
And again, that's, I like, all modalities, taking care of all my patients, no matter what they, choose. But you get a chance to really have a little more time with the home dialysis patients when they come in and really get that other insight of what it is. So, and I learned that, from my sister. One day she did peritoneal dialysis, and she was on her machine, and she was up walking around and doing all this stuff. And I'm like, what's going on? Like, her machine was alarming, and all of these things, and she was so irritated and frustrated because she had to, kind of move around to get her catheter to be in the right, place with the fluid. And so you're like, wow,
it's sort of like back in the days you walking around with the antenna. A lot of people to get a good signal, right?
Exactly. So you're like, oh, okay, you're not knowing that. Or she had went out, was going out with her friends, like to a club or something.
Okay.
So she was kind of setting up her machine, so when she got home, that she could just get on the machine immediately. You don't think about all those kind of things, because at the back of the person's mind, for somebody that's doing PD, for instance, you got to pre-plan everything that you do.
Yeah.
I
know it.
It's like, I got an appointment in the morning. I need to be on the machine by this time, or I got to work tomorrow, or I got to do X, Y, and Z. Everything is a plan, Yeah. And so, and that experience made me a better nurse for my patients and a better nurse practitioner, because that's what helped me inquire a little bit more or dig a little bit deeper, instead of, you need to do this, and this, and then that's it.
Okay. Well, that's good.
Yeah.
I don't want to put nothing on the other nurse practitioners, but I mean, maybe if they had a program like that where, you were paired with someone to see, because sometimes, and I'm not putting everybody in a box, right? But you do have some healthcare professionals they're cold.
Yeah.
They are cold, and it's just, okay, this is what it is. I learned this, and this tells me that, and this is that, and that's it. So with you, what I'm hearing is, because you had that experience with your sister, and how is she, by the way?
She's doing great. She's transplanted,
Nice.
7 going on 8 years.
That's what's up.
With the kidney and the pancreas. So she's good.
That's awesome. That's awesome. So being that you had that experience with your sister, your approach, and also your perspective, of course, but your approach to patients is a little bit different.
Absolutely.
And there's some grace that comes with it, again, because for me, again, I'm not a healthcare professional, but an experienced professional. I started off with PD. I couldn't stand it. I wasn't getting the results, because for me, I took my health very seriously, and I had one of the greatest nephrologists, I believe, in the whole wide world, who taught me. She was like you. She taught me how to read my labs. She educated me. She made sure I understood what each line item meant. And she really trained me to take hold or take control of my health. And so I read every number. If this wasn't right, I had an expectation. I had a goal I wanted to meet, and it just didn't work out for me. You mentioned something earlier about having better outcomes at home. What, being on dialysis, and I experienced the kind of opposite though. I had better outcomes switching over to hemo in center with my lab work. So what did you mean by that?
So there's a few things. So again, that's when we go to that individualized care, because everything is not for everyone. Right. And that's the beauty of, I don't know about other countries, but the United States, with having in-center hemo, home hemo, peritoneal dialysis, transplant are all treatment options, for our people. Transplant is not for everybody. PD is not for everybody. Whether it's something you physically just don't want to do, or to your body just won't allow you to, have better clearance because of the way your makeup is, so those things come into factor. People's physiology may not allow them to do well.
Okay.
As far as home hemo tends to be better on the heart, for people.
Really?
Mm-hmm.
Okay.
Yeah, they have that is better on the heart to do the frequent treatments.
I see where you getting at. Okay. Okay. Oh, the frequent short. Okay. Got it. Okay. You're right. Because in center, you're 4 hours, 3 to 4
Whatever you
hours.
taking off.
Yeah. Okay. I get that part. That part. I'm glad you broke it down like that.
Yeah.
Because I was blaming PD. I was blaming because I didn't like that KT over V. You know what I mean? That clearance. See, I know that KT over V wasn't coming out right. And I was like, man, that PD sucks. I don't like it. But it just could have been, to your point. See, I'm learning stuff here on the corner, right? Because it could have been my body makeup that just wasn't doing. So it was my fault. Okay. I was, sorry, PD. Sorry, peritoneal. I blamed you. I blamed you for 3 years that you suck. That's what. So it could have been me.
I had a patient that she was on home hemo, and she felt so good. She said it felt like she wasn't even on dialysis.
Really?
That's how well her treatments were. And she, besides looking at the, stuff in her house, I mean, she physically felt that she was not, on dialysis. And she was a person who used to hike, ride bikes, very physically active. And she was, kind of tired and drained when she was in center. But when she went to home hemo, she was back doing those things that she used to do. So those are the kind of stories, that I love,
Yeah, that's good to know. And I hope that some of our audience is getting a gist of this, because you gotta do what works for you.
Exactly. That's all it is at the end of the day.
Yeah, you gotta do what works for you. As a caregiver, how important is it for that caregiver to get involved with the development process of that treatment plan? Now, you first explained what a treatment plan was, and you also explained, your thought process and approach to a treatment plan. But how important is it for caregivers? Speak to the audience and those caregivers out there who may not know that, okay, the person that I'm caring for has a treatment plan. That's first and foremost. You got to know that. I think most individuals just believe or think, well, so-and-so, he went to dialysis today, or she went to dialysis today. And they don't think to know that there is a treatment plan. So speak to how important that is for that caregiver, and also give us a little inside scoop on how to approach the healthcare team to get involved. Because sometimes that could be a little intimidating, right? Don't you think?
It can be intimidating. And then so on the healthcare side, we have to have permission to speak to the caregiver about, the person, for one. So it's not like we're trying to be mean, you're calling, what happened to my dad today, whatever. We have to we have to have permission, but when we have that permission and everybody's involved, it's important to know what the goals are for the person and what it takes to meet the goals. So if you're the main person who's cooking the meals and buying the food, you need to know what dad or your husband or your wife is allowed to have. Now, obviously, I deal with adults, so people are grown. They're gonna
Oh
eat,
yeah.
what they want to eat and do what they want to do.
Oh yeah.
And if you see your person that you're caring for going, now I'm saying every single thing they're eating, are you supposed to be eating that? Are you supposed to be? Because
Right.
don't do that either.
Don't do that. Don't do that.
Don't do that.
Right.
But if your person is struggling in a certain area and you know that they're not meeting those goals, you may need to ask them, what can I do to help you, meet these goals here, and
Right.
if you're consistently, cooking baked potatoes and tomatoes and bagging all these
Potassium.
chips and keeping them in the house. And so for the people who don't know, all those things are high in potassium,
Yeah.
which would not be good for most. I'm not gonna say all, because some people I tell them to eat it, but for most of our patients who are on dialysis. So kind of partnering with them. And I mean, I've seen some pretty messed up situations where some people are like, well, that's them, they on that, not me,
Wow.
and
Yeah, it's true. It's out there. It
it
happens.
is out there. It's not frequent. And
Hi, I'm Dr. Amaka Unanya, and you are watching the Kidney Korner Podcast.
I'm the kind of person who never gives up on anybody, and I know that everybody is not like that either. So you have the people, well, I told them, that they shouldn't be eating that, or I told them not to do X, Y, and Z or whatever, but still be patient with the person, because dialysis is not an easy life. The treatment is not easy. The diet is not easy. The medications are not easy. So it's easy for the person on the outside looking in, saying you need to take all these pills and eat this certain way and go to the treatment and all that. But you have to show the person grace, because this is not an easy life to live. So don't give up on your loved one. Find out what they need from you, and so you can help them achieve whatever goals that need that they want to achieve, actually. So I would say most definitely find out what needs to be done. How can you help? And don't give up on the person, or, have an attitude of, well, I told them, that's not cool.
I got you. Understood.
Yeah.
So with that, from the caregiver's perspective, with their treatment plan, how much power does a patient / caregiver have negotiating what goes into their treatment plan?
Well, it really depends on your care team. Because unfortunately you do have those people like, well, this is the plan and that's it, and sometimes we do have to be firm on things.
Let's can I stop you right there? I just want to stop you right there, because people need some help. I mean, people watching this and listening to this, they really need some help with that. How to navigate those situations where it's sort of like your mama and them, and do what I say, not as I do. And that's it. Well, why, mama? Because I said so.
Yeah.
Okay, that's grown folk, little people.
Yeah.
But now it's grown folk to grown folk, and I'm the one that's the patient. What is your thought process on someone, because you see it every day? These families who struggle with that. When a healthcare team does something like that, and it's like they wouldn't even hear me.
Yeah. I would say the person will have to approach it, with the understanding. I understand what you're saying, but can you please explain to me why it has to, be this way, and why aren't there any other alternatives? I'm not going to say that that's always going to work 100%.
Okay.
But most definitely it is the approach, because sometimes you'll speak to a patient, and this is not often, but you will get somebody who's rude, and will talk to you any kind of way. Well, I'm not doing that. That doesn't make any sense, and blah, 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 blah.
The
blah,
other
blah,
side of it. The other side of the coin.
And I mean, we are human.
Yes.
Too. And we're supposed to be professionals and supposed to handle things differently. But at the end of the day, we're human as well. So for some people, that may be a turnoff for them not to even try to even work with you further, or even try to listen to what you're saying.
Right.
So you can partner. So I have a couple of people who every time I see them, when you going to cut my time down? And I said, I cannot cut your time down any more than what it is, So I tell them your KT over V is 1.27, for instance.
Okay.
And I said, the minimum they want KT over V is 1.2. I'm like, you're right at the border. If I take any more time off of your time, then you will not be getting adequate dialysis. And I tell them, for a while, you're going to feel fine. You're going to have a KT over V of 1.1, 0.9, and you're going to feel okay. But over time, you will not feel okay. And I said, so I'm not going to do that to you, because that's not adequate dialysis. So, but we're fine. That person doesn't cuss me out or, anything like that. They ask me every month. And my answer is the same. And I always tell people, if I can cut their time down, I will. And I have.
Listen, I don't blame him. I was there. I was definitely there. So I don't blame him. Just in case you forgot.
Exactly.
Hey, you
a little bit
gonna
of
cut that time, right?
Exactly. But a little bit of explanation on the reason why we're doing this, not just because you just got to run that way,
Okay.
Or we got this goal to meet with CMS and blah blah blah, But no, you will eventually feel sick, because they'll say, "Oh, I cut my time on Saturday and I felt great." But if you continue to cut your time,
eventually,
continue. And just giving examples, a person with normal functioning kidneys, their kidneys are working 24 hours a day, 7 days a week. You're here 3 days a week for 4 hours. That's 12 hours a week. You're missing a lot of filtration.
That's half a day.
Yeah.
And
so even though I had this conversation every month, if you don't ask, the answer will always be no, I guess. But,
okay. Yeah. And how inquisitive do you feel patients need to be? I think I was just a different cat. I wanted to know everything. I even wanted to know how that machine worked. I was like, what's that cable? What that do? What's that little thing down there? It look like a filter. What is that? Mm-hmm. Do you see enough of that or no?
I do not see enough of it. And when I do see it, I love it. And so, and it's to the point where I have some people like, well, I'm sorry, I'm asking so many questions. I'm like, never be sorry for asking questions. Never be sorry for wanting to know about your care and what is going on. And when I used to be a tech on the floor, when we had new patients, you show them the machine and I did. And I would show them something new every time. And you could judge by the person how much information they can take all at once, to know about stuff. And as they started asking more questions, I started telling them more information. This is your dialyzer. This is your, like your kidney, your external kidney. And this is what it does. These are the compartments. I would go that deep with people, whoever wanted, however far they wanted to go. These are the numbers on the machine. This is how much fluid is being taken off of you. This is the temperature, blah, blah, blah. Because I always wanted them, if they ever left that clinic, like I say, people traveling, what needs to be done to you and what should not be done to you.
Right.
So, and I obviously took that into the home dialysis, because they're actually doing, what needs to be done. But people need to know what should be done to them, what should not be done to them, because this is your health. All the way to the access, you'll have, things done to your access that should not be done. And so when I see it, don't let anyone do that to you. This is your lifeline, just telling them like that. You want to keep this as long as possible. Do not allow X, Y, and Z to occur. I don't care what they say. When I had PD patients, different things I would say if they had to go to the emergency room people are great at what they do with emergencies. They may not know about dialysis, so I'm telling you what needs to be done for you. I'm not telling you to be combative with the doctor or the nurses. If you need to call me, because we had open 24 hours 7 days on the on-call phone, say, wait a minute, let me check with my nurse first before y'all do this. If you didn't feel comfortable, what needs to be done. And just because this person is a doctor, just because they're a nurse, doesn't mean that is right for you. You don't have to have an attitude. You don't have to, you're asking questions. You're asking questions for your health, because this person will be gone on about their business, and you will be in the hospital. You would have lost your access. You will be sick. You will whatever, because you allow for these things to happen, or you didn't know. And I know some people just want to come to treatment and just let people take care of them. And that's it. They don't know about their labs. They don't know about their medications. They don't know about anything that they need to take care of themselves.
Right.
And I'm always on them, and one thing, like for my sister, when she goes to the doctors, she's like running down her medicine, the doses. And she said the doctors look at her like, so all that? She was like, yeah. Why wouldn't I? Why wouldn't I? So they're amazed with her record keeping, her knowledge of her medications, and what's going on with her, because she was like, I would like to live a long life.
That's right.
Without being sick. So yes, it is most definitely a great thing for patients to be inquisitive. And I always even tell the patients too, for me, you can ask me as many questions as you want, and hopefully other people won't, mind that too.
Right.
But don't let it get you down or discourage you if you feel like you're bothering somebody, or they're showing that they have an attitude or with it, especially if it's your regular, dialysis center. Just don't ask them nothing else. Ask the people who's willing to teach you. And just checking out, even, you need to know what kind of dialyzer that you're supposed to be on. So when you sit down, that this is correct. I've had patients, catch things before. I thought I was on a X, Y, and Z, and it was, and that person was correct. Now it wasn't a mistake because the order was changed, but the patient didn't know that
the order was changed. Right. Okay.
So, but it was good that person was paying attention.
Right. Absolutely. I was that dude. So yeah, that was me. That's who you heard. It was me.
Yeah.
So, it was me.
Yeah, so absolutely know what needs to be done to you,
right,
so you can look out for yourself.
Look out for yourself. Now, as you were speaking, Nakia, something popped in my mind. It's very profound, because as a patient, we look at caregiving as an outside thing coming in, right? But as you were speaking, a thought popped in my head that we could be a caregiver for ourselves. So in your own way, let's look at the difference between caregiving and advocacy. What's the difference? Because I believe a patient could be providing their own care, right? And then you have the advocacy piece of it too. You mentioned some of that, but I want you to go back and try to, divide them up to see what the difference is, because I truly believe when we think of caregiving, we or a caregiver is someone giving care to a patient. But I think a patient can give care to themselves, right? Because we have self-care, right? We got self-care, that thing. So talk about that. What's your thoughts on that?
So I would say caregiving for yourself is kind of the things I just explained, knowing about your body, knowing about your medications, knowing about your treatment, being involved in your treatment plan, being involved in those decisions, and then making the decisions that's going to keep you at optimum health. Advocacy in my way, you can advocate for yourself by doing some of those similar things, asking the questions as far as what things that I can do differently to still achieve this goal besides what you're saying. Is there some other avenue that I can do to achieve, that particular goal? That could be, we talked about binders, phosphate binders. We know most of our patients have to take these phosphate binders to keep their phosphorus in check. Okay, I want to keep my phosphorus in check. I don't want to take these binders. Is there another one that I can try? Or, why are you keeping me, on these? I'm taking them. These pills are like horse pills. I have to take 3 of them 3 times a day. That's 9 pills. Is there something else I can
right do? Is there an alternative? Right.
That is alternative. So that will be advocating for yourself. And then obviously our patients can advocate for other patients, which I've seen that done as well. So maybe these particular people don't have a caregiver or someone caring for themselves, or I work with, patients who show concern for other people, and they advocate for other patients.
Right. Right.
So, but yeah, I think is a close thin line between the difference of the two, but I do think they're different in my personal opinion.
Yes, thank you. Yeah, I thought so too. As I was thinking about it, I just wanted to get clear because you the one got all them things behind your name. You know what you talking about. I just thought about it. That's it. So, okay, so as we know, this whole thing, this whole arena as it relates to kidney disease, kidney failure, dialysis, the treatments for kidney failure, caregiving. From your experience, what has been some mental breakdowns as a caregiver, or what you have witnessed watching other caregivers? Let's talk about that mental piece.
The mental piece is really, you see the person that you're caring for go through a lot of changes, go through a lot of health challenges, go through their own mental health challenges, and the feeling that you can't change it. You can't make them better. You can't, make the situation better, and you're just there. And sometimes you feel, helpless in certain situations. And is a challenge sometimes to take care of people with failing health. And it could just be mentally exhausting for some people, just like it is for the person that's actually enduring what it is. So
right. Did you experience any mental breakdown when you were caring for your sister?
Kind of, because she's my baby sister. I'm the oldest of 4 siblings.
Okay.
And just to see, even though she's a grown woman, it's just like our parents always see us as their
babies, right? right.
But just to see everything on the other side, because people will tell her, well, you don't look like you're sick. You don't look like there's anything, wrong with you or whatever.
Been there, heard that.
Yeah. And it's just like, you don't see that other side of what the person has to deal with. You don't see the medications. You don't see the treatment. You don't see the days where they don't, feel really well today or whatever. You're just seeing a smiling, laughing, whatever person, and it's, oh, you don't look like you're sick, so, so
Yeah.
that part, and just seeing your loved one, go through that. I'm sure, people see it with their spouse or, whomever, their friend and all that kind of things, but you see the other side behind the smile,
Right. So
And
what were some of the things that how did you cope with seeing baby sister go through that? How did you cope?
I mean, really with prayer, to be honest.
Okay.
And just trying to understand more of the, disease process. So not only helps her, it helps, my patients that I care for in the clinic and not just at home. But I mean, it's just really, prayer and just focusing on the better times,
Okay.
and to be honest, because my sister is so resilient and so strong. I mean, she is most definitely an inspiration for me.
Mhm.
Like truly many of my patients, the resilience is outstanding. And it's
Okay.
like, wow, the patients really give me strength, to be honest.
Okay.
To be honest, I have, very young patients, 18 years old,
Wow.
who, dealing with health issues all their lives, and all the different health challenges that you hear that they have experienced or, are currently experiencing, and how they bounce back in their attitude,
Right.
and it's like, wow. I mean,
Right.
so the patients are, very strong and can really give strength to the caregiver. For sure.
Right. That's awesome. That is really, really awesome. So she was the one who was really giving you the energy, per
Absolutely.
se. Per se.
Yes.
That's really, really good. So you said, you mentioned that you had other siblings. Was it a collective thing, or was it because you were the professional? Um, was it collective?
And with the caregiving.
For the caregiving.
Nope, it was just me, and she just happened at one period of her life while she was on dialysis, live with me, and that was it. But wasn't a collective effort. Uh, and actually, one of my siblings is, to me, more in a denial aspect.
Mm.
Um, because she tries to educate, the family on different, health issues and what it can lead to. And I'm trying to prevent that for you, and blah, blah, blah. And, and it's like the attitude that some people have, well, that's not going to happen to me. And again, looking at her because she looks great and you don't see her down, you
Mhm.
think that nothing is happening.
Yeah.
And it,
Yeah.
it can be happening internally.
Yeah. Eh, that's the piece that a lot of individuals who are outside of this particular arena of kidney disease, what they fail to realize is that it's not generally outward. It's more internal of what's happening with us. You could see me and I can look fine,
Mm-hmm.
but I feel like, you know, crap.
Exactly.
I really do. And, you know, I couldn't stand that. You don't look like you're on dialysis. You look
Mm-hmm.
good. You look fine. Well, I appreciate that,
Mm-hmm.
but I am on dialysis
Exactly.
and I'm not feeling well today
Exactly.
or this moment.
Mm-hmm.
so so we have to be careful, folks, how we perceive other people. I always say you never know what somebody's going through.
Never know.
You never know what somebody's going through. So we're gonna wrap it up. One last question is, out of everything we've talked about thus far, what is it that you truly want the viewers and the listeners out there to walk away with?
Most definitely, as someone caring for someone else that's has kidney disease, that person is still there, but it may not be the person that you once knew. So the expectations may be different. You need to give them grace, give them time. Dialysis is not easy. And again, the diet is not easy. The medications are not easy. No one that I know wants to really be sick. So
Right.
no one is deliberately doing or not doing certain things to be sick. Is a difficult life, and you have to show those people grace. So they're still your husband, they're still your sister. They may not feel like doing certain things. They may not be able to take out the trash. They may not be able to do those things that they once did, but they are still there and they need to be shown grace. It's a different life. It's a different way to live, and they need your support. And you need to ask them in which way you can support them, because the way you want support may not be the way they want support. Ask those people, how can you support them in the way that they want to be supported?
That is just beautiful. Because wow. I love what you said. And I hope someone out there is listening. And it's not such a bad thing. And we that person, that patient, the person that's the patient understands that you love them. Let's just get that clear. They understand and know that you love them. But it may not be in the way I need it.
Mhm.
And I think a lot of families struggle with that. They struggle with, okay, I think this will work.
Right.
I think
I don't want
no.
I don't want that.
I don't want that. And sometimes the patient doesn't know what they want. They don't know what they want. Because I have experience where some individuals try to make things, and you said it. You said it. I'm so glad you hit on it, Nakia, is that it's different now. I hear oftentimes, and I thought that was the last question, but you sparked something.
That's okay.
It was another one of them certifications that came up.
That emerged.
That emerged, right? Because people try to, I hear this so much, and I try to get them to understand. Maybe you can help me when I'm out there educating and trying to help individuals as well. But they say to me so much, I'm trying to get them back to a normal, like how things used to be. And correct me if I'm wrong, Nikki. I tell them there is no back to normal.
No.
This is the normal today.
That is correct. This is the new normal.
This is the new normal, right?
Exactly.
And again, folks, don't get me wrong. I know y'all hearing me like, Craig, I can't have no fun. Blah, blah. No, I'm not saying it, because I'm gonna call it what it is. Dr. Davis has said, Dr. Davis has stated that yes, you should get out. You should do things. However, like her sister, she had to prepare. It was a different go out this time, because I know, thinking ahead, when I come back here,
exactly,
I ain't gonna feel like putting them bags together and cleaning the thing. I need it ready.
Yeah.
And we can hang out, we can go out, but not all day.
Mm-hmm.
Hey girl, I know, girl, we used to hang out, we used to cut it. Yo, just for 2 hours.
Yeah.
So I'm not too far-fetched from.
You're not too far-fetched. No.
Okay. Because some people just think trying to put that individual back into what they feel as though is a normal. Oh, this will help them not think about being ill or sick. Have you experienced that or seen that?
I've seen that. I mean, I know I'm talking about my home people a lot, but we had a couple, husband and wife, and the husband did everything. And she was like, basically like, fix him, make him back to what he was. And so we literally, had to pull her to the side, like, hey, that's no, and he, and then, I mean, this is a whole different, conversation about, roles and stuff in relationships or whatever. And, he wanted to be who he was. He was the man of the house and and did X, Y, and Z. And so that made him feel bad when she was basically like, fix him. I want him back.
Oh, wow.
And it's like, no, you have to, that's what I'm saying. Show people grace. It's different now. And it's gonna be a new normal.
Right.
It's gonna be a new normal.
Yeah, I know it's kind of hard. Those who are listening and viewing this episode, I know it's hard. It's not that you're stuck, right? It's just right now. It's just for the time being right now. Because I'm a strong believer that you got to listen to your body.
You got to listen to your body for sure.
You have to listen to your body, because your body gonna tell you, no, not today.
We're gonna sit down, or we're gonna sit you down. Now, which one?
Exactly. And I know that your loved ones are encouraging you. Hang in there. You can do it. But the important thing I believe is listen to your body. Partner. What I got is, also partner with your healthcare team.
Yes.
As best as you can. As best as you can. What's your take? Last thing. Oh man. What's your take? Because I tell people, hey, a doctor could get fired.
Yeah, exactly. Because these are the people that's on your team. They're supposed to be taking care of. So, okay, you're not doing what I need. Bye. Just like you would do, anything else. But if you want to, I think people should really approach the healthcare team and say, hey, I'm concerned about my health. I want to know everything that I need to know to keep myself healthy. How can we work together? How can I be involved in my treatment?
Nice.
And hopefully that's accepted. It will be insane for somebody to be like, no, I don't want to involve.
Right.
You need to get some new people.
If that's the case, they out of there.
Yeah, out of there.
Well, listen, Nakia, thank you so much for being on the Kidney Korner Podcast. You are welcome at any time to come hang out with us.
Thank you. I appreciate it.
Yes, I thoroughly enjoyed it and enjoyed you and the conversation. I'm going to put you backstage for just a second while I close us out. Okay. So thank you so much. We'll see you soon.
All right.
All right. Hey, folks, I had a great time. I didn't want it to end. I swear to you, I didn't want it to end. It was really great information. If you want to reach out to Nakia, we ask that you reach out to us and we'll reach out to her. We ask that you would email us. It's been scrolling at the bottom of the screen, and we know those who are listening on the Apple Podcast app can't see that. So I'll give it to you. You can email us at info@getinposition21.org or visit us on our website at www.getinposition21.org. Also, like, subscribe, and please share this episode with individuals you may know who may be dealing with a loved one in end-stage renal failure or on dialysis, someone who may be seeking a transplant. They need to hear this. They need to get educated on how to be a better caregiver and how to advocate for themselves. All right. So as always, folks, we'll see you next time. And remember, make sure you get in position as it relates to your health. We see you soon.